What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni Dita. Keoni, how are you?
Doing great. Hi, everybody out there. This is another podcast on, I guess, UTIs. Last time we talked about candida, which can definitely cause a urinary tract infection. But I think today we're specifically going to talk about bacterial infections
Yeah,
of the
something
urinary
super
tract.
common. You
Something
see them all
very,
the time.
right, something very common. Anyway, it can be bacterial, it can be fungal in origin. There's many different types of bacteria that can cause it. The main one that seems to be the problem is E. coli. So anyway, what are the risk factors for urinary tract infections? Well, being female is one of the risk factors, and a lot of that has to just do with the anatomy, just having a shorter urethra than men, but men can certainly get it. It's also related to history, family history. There's some correlation there. Definitely with sexual intercourse frequency, pregnancy, probably due to the hormonal environment, makes you more prone, and then also low estrogen levels. Think menopause, where hormonal levels drop. This has a lot to do with the vaginal mucosa or the urinary tract not being protected by the extra estrogen and creating a flora that can stave off bugs that can cause harm or cause these infections. Allergies, a big one that I always ask is, recurrent antibiotic use. So antibiotics, the more you use them, the more likely you're going to be resistant. Bugs are going to be resistant to it, and the more likely you're going to get them. And it is the number one treatment for urinary tract infections. And they certainly have use and should be used, to prevent the spread. Because one thing you don't want with these urinary tract infections is for it going to the kidneys and going further up the urinary system and causing problems there. But antibiotics are a big problem. And with that being said, antibiotics kind of tell you how to help treat it. And we're talking specifically about probiotics, right? So if you're using antibiotics, you're killing off all the good and the bad flora. But by doing that, the bad flora are able to create a better foothold after the use of antibiotics. So using probiotics certainly is a natural way to help prevent these and even treat these UTIs. Incontinence is another one. Diabetes, having a high sugar environment. Also, your immunity is lowered by being diabetic. Any type of abnormal urinary flow. And then, of course, every single nurse knows this. Anybody who's familiar with catheters, they are a big cause of UTIs for both men and women. The signs of these is just burning, stinging upon urination, definitely more frequency, urgency with urination, a strong odor, sometimes cloudy. It's colored. You could see actually blood, traces of blood there. Pressure in the bladder, lower abdomen, fever. And then if the bug travels, you get usually a very high fever, chills, vomit, and flank pain, especially if it's further up into the kidneys or anything like that. Urination is painful, and it's like you feel like you have to go all the time. Those are the stereotypical symptoms. The conventional treatment is antibiotics, which has its upside, but a lot of downside too. One of the things that I found with treating these UTIs is that a lot of healthcare providers forget about what's actually going on with the vaginal environment as far as hormones go, and specifically with things like estrogen. You see these a lot with perimenopausal, postmenopausal women, and unfortunately, they're running back and forth to the physicians and getting their course of antibiotics and just getting recurrences of these. And usually a recurrence of these UTIs, whether caused by the primary one, E. coli, can also make you more prone to candida and fungal infections. So you get those on top of it.
Mm.
And one of the ways to help stave this off is with topical estrogen. As we said, low estrogen increases the risk of having a urinary tract infection, which perimenopausal, postmenopausal women have. It creates a thinning of the mucosa, the vaginal mucosa, the urinary tract, and just makes it easier for these bugs, the negative bugs, to have a firm hold on the mucosa.
Right. Right. Yeah, it's interesting, Keoni. One of the additional signs and symptoms that I see really common, like the skilled nursing facility setting, is it altered mental state and then balance issues, particularly when people have UTIs.
Oh, that's very interesting. Yeah, you know, I haven't worked in that environment, but that makes sense. I mean, it also makes sense from the perspective, right? One of the ways to help prevent them is increase fluid intake, right? So a lot of these nursing facilities, I see a lot of problems just from dehydration, people not drinking enough and stuff like that. And if you increase your fluid intake, it really does seem to help prevent them, because what are you doing? You're constantly flushing the kidneys, you're constantly flushing the urinary tract. And the bugs can't really get a foothold on the mucosa. So it's really good to increase your fluid intake. And also another thing is don't hold your urine. I mean, when you need to pee, urinate as soon as you need to. They also have a correlation. They see a correlation with people who kind of hold their urine and don't pee are more prone to get them.
Interesting. I
Yeah.
always heard that. I didn't know if it was like an urban myth or
Yeah.
true.
Yeah. And I just think about it's as easy as common sense. Just think about flushing the urinary tract, and doing it on a regular basis. Another thing is wearing cotton underwear. Certain types of underwear seem to promote it. Anything that's really doesn't allow you to breathe in that area may cause more problems. There's also a hygienic issue. Wiping from front to back.
Yeah.
It avoids transporting bacteria from the anus into the urethra and stuff like that, and again, that's one of the main ways E. coli can infect the urinary tract.
Yeah, I told Haley before this, and who's a nurse, and that was the one thing she wanted me to make sure we mentioned.
Oh, really? Yeah.
Yeah, and it's super common. I mean, even
Yeah.
as a 27-year-old male working in a skilled nursing facility, I have to know it because those situations arise, and it's like something I wouldn't necessarily think of off the top of my head. You could certainly be contributing.
Oh yeah, you're definitely contributing a lot. I mean, and you just have to be aware of that. And some people don't know, but it's one of those things. There's a real hygienic issue there that just needs to be taken into account. What else here that I wanted to go over? So how's it typically diagnosed? Typically people will know. I mean, you get the symptoms of burning and urgency, but from a physician's point of view or a healthcare provider's point of view, you should run tests, and usually it's a urinalysis, right? And in that urinalysis, you're looking for signs of bacteria, even protein, traces of blood in the urinalysis. And then if you really want to be more specific, and people really should be, docs should be, you can then try to do a culture of whatever bacteria you may find that may show up in the urinalysis. And a lot of docs don't do this because what they do is they're just like, well, based on my region of where we are in the country and based on this antibiotic, this type of bacteria seems to be the main cause of the urinary tract infection. I'm going to use this antibiotic. Whereas that's really not great medicine. You really should try to see what is causing the problem and then go from there.
Yeah, it sounds like insurance care.
Right. Yeah. Right. Another interesting thing that I see is there are plenty of people who will have bacteria showing up in their urinalysis but have no symptoms. And sometimes this may speak to them being immunocompromised. If you're immunocompromised, your immune system doesn't really react strongly and you may not have the stereotypical symptoms, and that shouldn't be blown off either. So, but the whole point, the main reason why me and you wanted to talk about this is there a way that can help prevent these and treat them from a natural perspective and help lower the frequency of negative side effects of the conventional treatments? And yeah, there certainly are those types of things that can help. And so let's go over those real quick here.
Mm-hmm.
Oh, one another thing that I just wanted to bring up. I see it kind of closely tied to this, at least in symptoms, and also yeah, it kind of mimics UTIs in a sense, and that's interstitial cystitis, and that's basically like inflammation of the bladder. But a lot of times these people, it's kind of a diagnosis of exclusion where, you know, you and a lot of women and men to some extent, but a lot of women mainly are being run around from physician to physician and being told, well, you don't have a urinary tract infection, we don't know what it is, and really the diagnosis may be interstitial cystitis, and that can be awful because that's like feeling like you have a constant urinary tract infection, but there's no signs and symptoms of it at all, and you get it from, you know, you just have it, and usually it has to do with inflammation of the bladder wall.
So what's the best way, Keoni, for the average person to go from, you know, point A to B to find out that they do have that? It's like you said, they get tossed around quite a bit in the
Right,
medical
right.
and the
Well,
conventional society.
it should be one of the first things healthcare providers think of if you can't if you rule out a urinary tract infection.
Okay, what you would do with the
Instead,
cultures and the urinalysis and that.
yeah, right, right. And it should be talked about, definitely, I think, with women who get recurrent UTIs.
Yeah.
And interstitial cystitis is associated with recurrent UTIs, although it's a different condition. There seems to be some correlation between the two. So, and there's not really a great treatment for it. There are some things out there. We can do a whole podcast on IC, but just real quick, you know, you may, I mean, conventionally, they've used like antihistamines and antidepressants to treat it. There's some specific drugs that may treat it. From a natural perspective, there are some food sensitivity issues with it, where there's actually, you can Google like the IC diet and try to eat that way and see if it helps calm things down. There's also you can use some called glucosaminoglycans to help supplement the bladder wall, both used used to inject into the actual bladder, or to a lesser extent, as far as efficiency goes and efficacy, you can also take these things orally. So these things are things like hyaluronic acid, chondroitin sulfate, are these glucosaminoglycans, which just help protect the bladder wall.
Yeah, good for your joints too.
Yeah, yeah, they definitely, these gags are very good for your joints. So we already talked about using estrogen. So low dose estrogen can really help. So intravaginal estrogen, topical, that's probably the best way to do it. Not so much taking oral estrogens. You probably really want to have something like an estriol cream, a type of estrogen that can help. That's one way we've certainly helped women that may be menopausal or postmenopausal. So that can help. Whenever there's any, whenever hormonal imbalance is suspected, that can be a really good thing. Another thing that can really help is, you've heard the whole cranberry thing, right? Like
Yeah.
drink. Okay. Well, just a couple caveats on that. Cranberry can be very good, and the studies are really mixed on this. And I suspect the studies are mixed on cranberry because cranberry, if you buy it in the food store, is usually loaded with sugar. So
Sure.
that's not a great way to go. I usually have my patients do cranberry tabs that are not
Mm.
that, or you get the pure cranberry juice, which is very hard to get down because it's very astringent, somewhat bitter, and very sour. But that's the way you want to do as far as the cranberry. So it does have some efficacy as far as helping prevent the infections, and may also treat. And one of the ways they help treat is to keep these bugs from adhering to the urinary tract mucosa. So that's one way to do it.
Is that like AZO? That's like a common over the counter I've heard of. Is
No,
that a cranberry tab?
I don't think so. I don't
Okay, no,
think
it's a
so.
antibiotic
It's
or
kind of
something.
it's not really an antibiotic either. It just helps. It's almost like I hear women talk about as far as like helping relieve pain and stuff.
Oh, okay.
Yeah. Um, but anyway, cranberry is a different thing, and some of the bioflavonoids in cranberry really help. And then also on top of that, there's been some research on blueberries also helping with that.
Mm.
Blueberry extracts helping. The other one that we brought up is probiotics. Probiotics taken orally, which may not make intuitive sense at first, but because you want to take probiotics, why are you treating a vaginal or urinary tract infection by taking them orally into your gut? Well, a lot of it has to do with changing the flora dynamic of your gut. Think about most of these bugs are transferred, or E. coli. They may be transferred via the perineum from the anus to the urinary tract. Also with sex, there's probably transfer of those bugs too. So that's one way. But also the other way is also to put the probiotics in the actual area where the infection is, in the vaginal canal, and around the urinary tract. And the specific one is lactobacillus. And lactobacillus bacteria are really good. And this is why a lot of nature doctors and naturopathic doctors will even recommend like homemade yogurt to do this. Now, certainly don't want to use yogurt that has sugar in it or anything like that, but
Hmm.
yogurt is full of lactobacillus that can help. And there are specific strains. They've tested out strains that seem like they do better for treating these UTIs. And the main one is Lactobacillus rhamnosus, GR-1. But anyway, any lactobacillus species is gonna seems to help. Um, there's actually a natural antibiotic that I use quite a bit called berberine. It's a plant
Mm.
alkaloid. It's found in things like herbs like golden seal, Oregon grape, coptis, barberry. There's even some in turmeric. We talked about that a lot, and it has natural antibacterial properties, and it's very effective in inhibiting the growth of opportunistic bacteria.
Right.
So that's a good one. Long-term use with it is not really. I try to tell my patients that you just want to use it intermittently. It should not be used as prophylactically, and just that you stay on it for a long time. And women who are pregnant probably should be careful with that too.
Gotcha.
Which by the way,
Sure.
pregnant women
Hmm.
who are getting UTIs, again, the hormonal environment is changing, which may make them more prone to it too. Um, One very common one is vitamin C and ascorbic acid, and it seems that it may have something to do with, the acidification of urine by taking vitamin C may inhibit the bacteria from gaining a foothold. And vitamin C is very safe to use, and this is where it may be really good with pregnant women who may be more prone to UTIs, where you can take 100 to 500 milligrams of vitamin C daily during pregnancy, and it has been shown to reduce the incidence of UTIs.
Okay.
Um, What else? One of the things that I use a lot is a sugar, and this, to help with bacterial infections, UTIs, and the sugar is actually called D-mannose. And it is found in cranberry, although cranberry has other compounds that help with inhibiting the urinary tract. But D-mannose is a type of sugar that seems to keep those opportunistic bacteria from adhering to the urinary tract, and specifically E. coli from adhering to the urinary tract. So it again, most of these natural compounds, it's all about inhibiting the adhesion. And if you can inhibit the adhesion of these bugs by making sure you're drinking plenty of fluids and something, a lot of times you can flush this all out before the urinary tract infection even takes hold,
Right.
or causes significant problems or travels up further up into the urinary tract where, at the kidneys or anything else.
Sure. So that would be one you could take pretty regularly.
Yeah, that would.
Mm-hmm.
Blueberry, D-mannose, cranberry, these things you can take regularly. Probiotics you certainly can take regularly. The herbals that contain berberine, you certainly can do them higher doses short term. It's not a problem at all. If you and a lot of these treatments you can certainly do in conjunction with the antibiotics. Okay. I just tell people, if you're taking an antibiotic, don't take them all together. Like, take your natural supplements away from them.
Okay.
Right. At least an hour or so away from it. What else? One thing that I just wanted to talk about is one of the ways that bacteria adhere to the mucosa. They do it with these small, like finger-like projections. They're called fimbriae, and they bind to the urinary tract lining, and this is where they take a foothold. And there are things out there called FIMH inhibitors. Okay, so they're basically inhibiting these little projections coming off the bacterial wall from attaching to the urinary tract. So compounds found in blueberry, the D-mannose is considered a stereotypical FIMH inhibitor. And then also in cranberry, and there's some other, I think there's even some synthetics they're experimenting with, just help block these things from adhering. So FIMH inhibitors are really getting a lot of play and a lot of research on them. And basically these are derivatives of D-mannose. A lot of these things are. So if you can block that, that's great. We talked about hyaluronic acid and chondroitin sulfate for interstitial cystitis. It can also be used for UTIs, although, it's a bit invasive because they're talking about injections. With interstitial cystitis, there is limited evidence that taking these things orally will help, but they certainly won't hurt. Okay. And I just haven't, in my practice, I haven't seen any wow factors with, I took my hyaluronic acid, my gags, my chondroitin sulfate orally, and bam, the UTI was gone. But I think taking them as a preventive can certainly help, because what they do is they can inhibit these bugs from really attaching and like burrowing into the urinary tract walls and stuff like that. So
yeah, so great preventative.
Right. I mean, typically the research on these is intravesical administration. So basically they're injecting it in, but if you can take it orally, which is a much better way to go, it's
that's hilarious that that's how they do the studies.
I know.
The average person does not have the ability to do that.
Right. When you look at it though, the main thing I would say for people is a lot of it is really, some of it is behavioral, right? So
you mean lifestyle, Keoni?
Yeah, well, again? Yeah, definitely lifestyle. But lifestyle, like if you're prone to them, like making sure you're wearing breathable underwear, like cotton underwear, avoiding tight fitting clothing, wiping from front to back, drinking plenty of water, knowing some of these things that can help, like cranberry tabs or pure cranberry juice, blueberry extracts, things like that. All of these things can play a role and can significantly keep these things at bay. So I just tell people that there's a lot you can do, and if you're one of these, and I've had a number in my clinic who've come, and it's constantly they're being put on antibiotics, and every time they get a urinary tract infection, another antibiotic, and we know what happens when that goes on. Pretty soon you become resistant, and then you can't treat them, and you're put on more and more powerful antibiotics, and then you get more and more side effects, negative side effects from them. So it's really not a efficient way to treat these.
Mm-hmm.
I actually use a product that that I use quite a bit. It's called UT Synergy. It's Designs for Health products, and it's just natural support for urinary tract function. At the first sign of a urinary tract infection, you want to put these things into place. And in that product, there's actually an herb in there that has gotten some play that not a lot of many people look at or think about, and that's hibiscus. And hibiscus does seem to have compounds in there that, like blueberries and cranberries, they have like polyphenols in there, and they just help to balance a healthy microbial populations, and then they help keep bacteria from adhering to the urinary tract walls. This is actually in that product. There's also another herb in there known as berry extract, and again, the same thing. It just helps maintain the urinary tract's natural defense against bacteria, keeps down the inflammation, has a mild diuretic effect. So anything you can take that promotes the flow of urine will help. There's another herb that I've used, but usually I use it in combination products, like this product is horsetail extract. It just supports the body's natural defense against the bacteria and other organisms, keeps the inflammation down, and also has mild diuretic effects. Another herb that can help is also parsley. And again, it's been used throughout the ages has a mild diuretic effect, maintains a healthy microbial environment. Another thing that has kind of a soothing aspect, again, this is usually in combination products, is aloe vera. It soothes the lining of the urinary tract. And by the way, it also will help with interstitial cystitis. It also has a number of antioxidant properties and kind of potentiates the other herbals that are in there. This particular product has D-mannose in it, which we've already talked about. And then it also has a vitamin B6, which also works in synergy with these botanicals I just mentioned, but also helps maintain a good diuretic, a mild diuretic effect that just keeps the urine flowing. Of course, you definitely have to drink. What else as far as herbals go?
What is that product, Keoni?
This one is the one I'm talking about. There's a number that are very similar. It's called UT Synergy. Okay. It's by Designs for Health. Yeah. So another one that has some properties on it that you may find in your spice rack is juniper berry. Juniper berry, it's very interesting. Juniper berries have a mild, they kind of have like a piney taste to them, a piney sweet taste. It actually, if you ever want to try a nice combination of spice with blueberries, try mixing a little bit of juniper berries in a bowl of blueberries. It's quite pleasant tasting. They kind of have a taste that they go well together, and they both have some good effects on the urinary tract. But that's another herb that you may think about.
What is it with the berries, Keoni? The berries kind of keep coming up.
It's just they're just packed full of polyphenols. All right, and that's probably and certain sugars that like D mannose is found in cranberry, um, that just inhibit these uh, these microbial projections from attaching to the mucosal wall. So it's just the compounds that are found in them
Mm-hmm.
that really help. But just think about what you're trying to do with a urinary tract infection. You're trying to maintain urine flow, right? A lot of times your body naturally does this. Your body's constantly wanting to, you feel like you have urgency to urinate. That's the natural way. Your body's like trying to get rid of a bug. So you can just think that's your body's intelligence, but you can really promote it by making sure you're drinking enough. You don't certainly don't want to drown yourself or in water, but you want to drink throughout the day and make sure you're well hydrated.
Right.
you know
Yeah.
and I want to bring that up because drinking too much water can be very dangerous, especially when you're urinating. I just don't want people going, oh, I have a urinary tract infection, and drinking 2 gallons of water or a gallon in a very short amount of time. That can be dangerous. You just want to make sure that you are drinking throughout the day, and if you're prone to them, that you're constantly drinking some fluids throughout the day, preferably unsweetened fluids that help.
Right.
So anyway, I think we've gone over everything that I wanted to talk about. Brian, is there anything else that you think we should hit on again?
The only thing I would kind of add from an interesting PT perspective, because I hear it all the time, is people talking about their pelvic floor health and
Yeah.
thinking it's a good thing or like an exercise to stop their flow of urine. It's really not a great idea and not what is recommended as like a pelvic floor exercise. You're really
I
thinking
want,
about
yeah.
lifting the bottom of your pelvic bowl with pelvic floor exercises as opposed to like ceasing the flow of urine. That would be that's a little bit more local to the
Mm,
genitalia, it seems like, than lifting the pelvic bowl. So separating the pelvic floor, because this is what people are treating in pelvic therapy generally, versus this kind of situation.
right. Right. Yeah, that's a good point you're saying there, because I think, and I'm guilty of this too. I think people get confused when they hear like doing Kegel exercises, it's stopping the flow of urine. But really, when you really look at what Kegel exercises are, it's really tonifying the pelvic floor.
Right.
And I don't know, like specifically stopping the flow of urine, if that's the best way to do it. Um, but you also sparked my thinking on this too. A lot of men are very prone to UTIs
Mm-hmm.
also because of one specific anatomical difference, and that's
Mm-hmm.
like when the prostate becomes swollen or you
Right.
don't get good urine flow. And
Right.
a lot of men where the prostate is really swollen and closes off the urinary tract, they have to catheterize themselves. I
Yep.
mean, that's the only way to help that, at least in the short term, and especially when you have to urinate. And that is a big contributor to urinary tract infections. And nurses know that beyond a shadow of doubt when they have to catheterize people. It's very important to keep it um, clean and stuff like that. Because what you're doing is you actually can take bugs that are inhabiting that catheter, and you're basically inoculating them further up the urinary tract, which makes it more prone to get into the kidneys and stuff like that. So I don't want people going away from this podcast, especially men, thinking that they can't be prone to a urinary tract infection. And Without divulging too much information, I've had urinary tract infections. They are miserable, and
Mm-hmm.
and it wasn't due to a catheter. So men can certainly get them.
Yeah, I've absolutely seen 50-50 split between men
Yeah.
and women
Okay.
as in
Yeah.
like my practicing.
Right. Right. So anyway, um,
So hopefully that was helpful. Definitely some preventative measures in there that are definitely beneficial. And then
yep.
lifestyle modifications as always. Anything
Yep.
else, Keoni?
I think that's it. I mean, I think you certainly, at the first sign of the urinary tract infection, if you know you're prone, you want to take these preventatives and start them right away. And at the first sign of a urinary tract infection, if the natural therapeutics don't get it taken care of within a day or two, or you
Okay.
start getting fevers or anything, you definitely need to see a doctor, and you're probably going to need to be put on an antibiotic.
Okay. That's a great
Yep.
kind of order
Yep.
operations and way to
Yep.
sift through
Yep.
it all.
Yep.
Awesome. Well, stay hydrated as well. And we will talk with you next week.
Take care, everybody. Bye.